What do you notice when that happened for you?
He's trying to do the psychotherapy for you now.
No,
Hi everyone, this is Dr. Justin here, and welcome to the next episode of The Bite Angle. All right, and over here we have Mr. Eric Lim, who is from Somnus Sleep, and here to talk more about sleep wellness, right? Sleep mindfulness, all right? And over here we have Dr. Bernard as well, who's
Hello.
joining us again. All right. So Eric, I've known you for a very, very long time. I've known you since when I was 18 or 19 in army. So it's been a while, and we really connected back on LinkedIn for a while already. And I was like, wow, this is like so close to what I'm familiar with, like dentistry and sleep, because nowadays there's a lot of connection between sleep and dentistry. So tell me, what do you do?
So hi everyone, I'm Eric. I'm the co-founder of Somnus Sleep Wellness, and yeah, really glad to be here. So what I do is really I help people to get satisfying sleep. So working a lot with professionals who struggle to sleep at night, especially when they lie in bed and the mind starts to race into the future. Also think about things that happen in the day. So one of the most common things I notice, where people experience sleep challenges is really this issue of insomnia. So at Somnus Sleep Wellness, what I do is really helping them to understand, what gets in the way of their sleep, and equip them with the strategies and the practices that can help them towards thriving instead of just surviving night to night.
how long have you been doing Somnus?
Coming to almost 2 years.
Oh, wow.
Yeah, so I used to work in a mental health charity when I first graduated. That was in 2014. So been in that space for almost to 10 years. And yeah, so in 2023, around September, I left. And the reason why I left is because I realized that so many people that I work with in the space, in the community as well, is that, they actually face a lot of stress. And many people are stressed. They often face one very unique challenge, which is they don't sleep well at night. And that prompted me to, really focus on, can we come up with a way, a platform where people can actually seek evidence-based solutions to help them with their sleep struggles, so that they can begin to be at their very best for their family members, for their work, and ultimately to live a more fulfilling life.
Okay, so like in terms of insomnia, is it what is exactly insomnia? I think that's a big thing, right? Because insomnia to me, it means that you have a difficulty sleeping, but is there like a deeper definition of it?
You mean like a clinical insomnia?
Is it like a psychological issue, or is it like a physical issue, things like that?
Yeah, so actually insomnia is a sleep disorder. And what happens, when people experience this, is that most of the time, yes, you're right, they do have challenges in terms of falling asleep, but it's not just falling asleep, right? It's also, some of them may actually be able to sleep, but they find themselves waking up in the middle of the night and find it very challenging to go back to sleep. And that gives rise to a lot of sleep anxiety. So as they lie in bed, they might begin to keep checking the clock and like counting backwards in their mind, how many more hours do I have left? And so it's not just about difficulty falling asleep, staying asleep, but also some of them might actually find themselves waking up earlier than their usual wake time. And that makes them feel very anxious because they're starting their day too early, way before the time that they wish to wake up.
So you're saying it's a psychological effect?
Yes.
of
Yeah,
it?
so
Okay.
most of the time it arises because there is hyperarousal. So what that means is, when they go to bed, there's a lot of, there's this elevated arousal level. What
Okay.
happens is the whole body and the mind becomes really very tense. And when the body and the mind doesn't feel safe, sleep becomes more elusive. And what happens is, over this struggle that repeats night after night, over time, they begin to feel like in the day, they are no longer as well rested. So for it to be considered to be insomnia, it's not just about what happens at night, but there's also daytime symptoms. For example, difficulty in concentration. They find themselves more irritable. They're less present with the things that they do or the people they're with. And it begins to affect different aspects of their life.
Sounds like me. You have that issue?
Yeah, I do.
Yeah?
No,
Okay.
it's a rabbit hole. So like for me, I'm like, when I think of something, it triggers the next course of thoughts.
Right.
Then okay, but I better not think of the first thought in the
Don't
first place.
think,
You know
don't
what? I
think.
just like, okay, I gotta shut it off. I need to think about something else, or not think of it at all. Things like that. Okay, that's really cool. So it's in terms of sleep. You're talking about quality sleep, am I right? Or is it just closing your eyes and that's
Yeah, so I guess in Singapore we are one of the most sleep deprived nations in the world, right? So
Are we
on
like
one
the
front,
top 10
we
or something like that?
are not getting sufficient sleep, right? On the second front, people are actually not satisfied with their sleep, right? So in fact, from what we have worked with our clients so far and the people that we give our talks to in corporates, most of the time it's almost 1 in 2 people. They share with us that they are not satisfied with their sleep.
1 in 2.
Yeah.
is that in front of the bosses? I'm just
It's like, boss, you make me work too hard.
and interesting, right? Because one of the reasons why people can't really sleep is because of work, right? So work begins to follow them in the bedroom. So even though we leave our workplace, right, it seems that we can kind of like shut our mind to leave it at the workplace itself, but it doesn't seem to be that case. So very often when people lie in bed, work matters still pop up in their mind. And that gets people very anxious. And it doesn't help if you receive an email at about like 11:30 p.m. and you feel the need to want to perform, right? Which means that, hey, maybe, if I want to get promoted, I need to reply to this email now. And that sets on this whole elevated sense of arousal, which doesn't help with the sleep.
So there's a lot of social pressure, I guess, also.
Yes.
Right.
I think part of it is also the nature of our society, where we are always gravitating towards productivity. And it's not a bad thing, but just that, if we get so focused on that and we forget that rest is actually really important for us to go the distance, then we begin to sacrifice sleep at night. And then it becomes a cycle.
oh, cool.
So what are the methods that you teach at Somnus Wellness? So basically, if I'm reading it right here, that you are a mindfulness-based stress reduction teacher, right? So run us by what you do exactly when you are working on let's say a client.
So for me, I think the first thing that I do is really to try to understand where they're coming from. What are some of the sleep challenges that is of concern to them, and why is it important to them to get that addressed. So it's really coming from this sense of curiosity in helping them to kind of unpack a little, right? And for me, just now you mentioned about mindfulness-based stress reduction, right? So I've been really in this space of mindfulness like over the past decade. And I think the key part here is really about awareness. And when we talk about mindfulness is how, are we able to pay attention to what's arising in the moment, with that sense of being non-judgmental. But the thing is, it's really tough, right? Because, especially when we lie in bed, when thoughts show up, especially, Dr. Justin, just now you mentioned about how we try to push away the thought, right? Or we try to not even think of it in the first place.
But it's like also a vicious cycle because the more you stop trying to think about it, you think
It
about
gets
it.
worse, yes.
And you're like, oh man, when it's a slippery slope.
It is exactly,
Yes.
right? So I think
Yeah.
the first part is really aware, what's really happening here. So sometimes even before the thoughts happen, right, we might actually feel in the body already. So a key part in the practice of mindfulness is this mind-body connection. For us to kind of notice, how's my body right now? What's some of the sensations right here? Even the feelings or emotions that's arising moment to moment. And too often, people begin to judge themselves a lot of self-critical thoughts, especially when, they feel like they're not done enough for the day. And then the mind continues to think about the future. And that's where, it's really hard to kind of quieten the mind. So many of our clients tell me, hey, Eric, I wish, there's this button in my brain that I can just press and my brain will just switch off. But the truth is, there isn't, right? And I think it's very important for us to kind of look in this aspect by how can we begin to take care of our day-to-day moments rather than just taking care of what happens right at the moment before we go to bed.
I'm assuming also that some people do come to you already at a point of frustration, and they have tried pharmacological means of falling asleep. With
Yes. Yes, yeah.
sleeping pills, melatonin,
Correct.
and all those
Yeah.
things as well. So, so I'll be very interested to know. Okay, so you are in a team of
Psychologists.
psychologists and therapists, right?
Yes.
And are each of you slightly differently focused in how they approach, let's say, a single client? If I came to you and I'm the one with this a sleeping disorder, and let's say I say, Eric, can you help me with this? And then you go, okay, well, I've assessed that I can help you with these mindfulness parts, but you also need to see my colleague who is going to be dealing with a separate aspect of your sleeping issues as well. Is that correct to assume?
Yes, that's right.
Yeah.
So for us at Somnus Sleep Wellness, we are more psychological focused. So my two other teammates, in fact, my co-founder, Dr. Giam Lim, he's a sleep psychologist. And my other teammate, John, he is also a sleep psychologist as well. So that's where they work with the clinical population to help address different issues. But what we've really focused here is really in the area of insomnia. So let's say, on the first session during the initial consult, what we do is really to kind of assess if there's other conditions, right, that might require attention. Sometimes it might be more medically related, and that's where we'll refer to either a psychiatrist or a medical doctor to look into that. Yeah, so I think that's where we really work with a team. So not within the company, but also we refer to other partners as well. So to work together to bring the solutions that can really help the client.
Yeah, I mean that's the whole. I mean, I guess sleep is a very big topic, right? It's like a lot of different things that happen,
It is.
right?
Yes.
Like even for me, last time I had this thing where before I sleep, I need to go to the toilet first. If I don't go to the toilet and I try to sleep, I can't sleep because I need to go to the toilet first.
Yes.
That's just me. And
Right.
but that's just one factor, right? There could be a lot of other factors that can affect it. Like, obviously dentists, we're looking at the jaw, the tongue, and if it's narrow, the arch, then it might block the airway. These sort of things can really still. So how do you filter them? Do you you do a screen for them first, or
Yes.
because
Yeah.
the patients, the clients who are coming to you, they obviously don't know what they have a sleep issue, but they don't know what type of sleep issue they have. Am I
Yes.
right? So how do you screen them, and how do you make sure that you are just treating the insomnia part?
So for us, actually, we did roll out with this Somnus Sleep House screening tool,
Oh, wow.
which is a 20-minute self-administered tool that can be done online. It's something that
You can
we
send the link in
also-
the description below.
Yeah. We actually work with AIA Vitality.
Oh, cool. Wow,
Yeah,
nice.
so for AIA Vitality members, they do enjoy a discount.
Oh, wow.
I think the key part is really to raise awareness. And this sleep house screening actually examines and assess people's risk for different areas. So there's one which is the Sleep Health Index. So it's something that we work together with the National Sleep Foundation of US. So it's a proprietary screening tool that we license from them for that particular part. We also try and assess people's risk for OSA, obstructive sleep apnea.
So obesity, all that stuff.
Correct.
Okay.
So especially, I think it's really common now, you may hear of friends or family members or even colleagues, right? And they tell you, hey, my partner or my spouse actually snores very loudly, and so loud that I can hear him from the other room, right? So that's actually one red flag. And I think many people aren't really aware, how serious snoring can be and when it becomes a disorder. So that's one. Another one is in terms of their stress reactivity. So we know that stress affects our sleep. So for people who are more reactive to stress, meaning when stresses
More
come
kamcheong
along,
lah, basically.
yeah, they tend to be affected a lot more, right?
Okay.
And that makes them more hyper aroused, right? And that is not very conducive for sleep at night.
So you get a score at the end of the test?
Yes, correct. So
Okay.
we'll tell them, how significant, or what some of the areas that they are more at risk of. including for insomnia. So there's one specific section that assess their risk for insomnia.
So there's
as well.
insomnia, there's apnea, I guess.
Yeah.
Which is the physical obstruction of the airway, right? Yeah.
Correct.
Okay.
So there's also another one, which is this like computerized test, which tests on their alertness. So very
Alertness,
often,
so like when you're sleeping and you didn't sleep well, then how
correct. So in terms of their reaction time, so there'll be a stimulus that will appear right randomly, and it assesses on their reaction time in terms of milliseconds.
wow, how accurate is that?
Fairly accurate, but not to the clinical level, because it's
But it's a
self-administered.
screening sort of tool.
meant to be
It's
a
an easy screening tool. Okay.
right? And that's often very indicative, to show if someone is very sleep deprived or someone has very poor quality sleep. Their reaction time will be very sensitive to that.
So what you're saying is that their alertness compared to a baseline or compared to their
Compared to
level?
someone who is
Well rested. Yeah.
more rested.
Right.
Yeah.
Okay.
correct.
Because I'm assuming, they say that the best reaction times of anyone are like F1 drivers.
Yeah, like they have the poles, right?
Yeah,
And then they
baseball
like,
batters.
yeah.
Right. So I think if there's a sleepy baseball player versus me completely alert, I think they'll still win.
Fair enough.
So like I'm just wondering about the baseline level, but it's
Yeah.
very interesting what you say about that. And so the I don't know about you, but yes, you can actually get quite sleepless, and it's almost that you have to follow a very strict hygiene, like sleep hygiene process, right? To get back onto track, especially if you're getting into insomnia.
Actually, not really.
Oh, really? Okay.
Yeah, so I think that's one of the misconception.
Right.
So in fact,
please, I
people
wanna know
who
this.
experience insomnia, they tend to be they follow sleep hygiene very closely.
Almost too much.
Almost too much.
Until it's like it's too rigid.
It's like they're
much,
stressed
so
about stress,
rigid.
Yeah.
To the extent that it stresses them out.
Right.
Right. So for example, we
Oh.
hear about, we shouldn't be, using our devices about 1 to 2 hours before we go to bed. And guess what happens to people who experience insomnia?
What happened?
They
Because now they cannot use their device, right? Because they're trying to keep to that.
get
They
stressed
get
because
more
they cannot
anxious.
like communicate, is it?
So they spend the whole time thinking about, oh my God, what am I going to do now?
really?
And that makes them
Oh,
more
wow.
anxious.
It's like counterintuitive. Yeah.
Yes.
Falling asleep. So I think
Okay.
that's where I think it's really important, right? For people who think that they may be experiencing insomnia to not self-medicate or to just find ways to.
But it's
to
very,
get
very
themselves-
paradoxical, I'll say. Because like even like when I'm having a trouble sleeping, I was like, okay, I gotta like relax now.
Yeah,
I gotta
yeah.
like, make it calm and everything.
Relax.
Relax. See, like, I think you just like, like you just more, if you're more conscious about it, the more you cannot sleep. You know what I
Yeah,
mean?
true.
Exactly.
Yeah.
You're right. And I
So
think
yeah,
that
that's-
comes back to what I mentioned earlier about awareness.
Yes,
right?
yes.
And how important a role that mindfulness plays in this, right?
Ah.
Because one of the foundational attitudes in mindfulness is actually that of non-striving. So when it comes to sleep, non-striving is really important.
What's
So for many
non-striving?
things-
Non-striving means you're
to
not
let
trying.
go, is it?
Correct.
You're not trying it.
We are
Yeah.
not trying ourselves to force ourselves to sleep.
Yeah, right.
So too often when it comes to, maybe one night's okay, but if someone experiences many sleepless nights, they become more anxious about it, and the urge and the desire, right, to get into sleep becomes stronger.
So how do you advise that sort of patient? Like what do you do before to try to be successful in sleeping well? How do you advise that patient?
I think the first thing is to not to see sleep as something that you fail at or get successful at.
All right.
Okay.
Because it's very outcome driven, right? Sleep is a very natural process that we just need to create the right conditions, and then sleep just happens. But what happens is when we are so focused on the outcome that, okay, I need my 7 hours of sleep, that fuels that striving a lot, and that makes it even more elusive.
Okay.
Yeah.
And I got so many questions now in my head.
for it.
So number one would be is there a minimum age for insomnia? Like, do kids get insomnia?
It is
Yes.
possible. It is possible. Yeah, I think
Like, how
parents,
old, like, you know-
we do see parents concerned about their children. But at the moment, at where we are at Somnus Sleep Wellness, we don't actually specifically work with children. So we work more with
so there is
adolescents.
like a pediatric sort of insomnia
Yeah.
issues.
Correct.
Okay, and that's usually related to what, stress also?
Stress.
Or- okay.
Yeah. So interestingly, maybe not interestingly, but it is true
Interesting
that
for you.
children do get stressed.
Right.
And why I say that, because like in my
Schools
previous
and everything.
work, I used to work a lot with children as well.
Okay.
So in fact, I go to schools to teach like mindfulness courses or run workshops for primary school students as well. And yes, they do get stressed. Sometimes it's, from themselves, from their peers,
Bullying
and
and
even
things
from
like that,
teachers. Yeah, or even being compared to others. Yeah, and I think that's where it makes them really stressed when they are not performing academically, right? And that gets them anxious about, do they have sufficient time to study, to do the things that they want?
Sounds like me again. I had very bad insomnia when I was a kid.
Really?
Yeah. So
What do
yeah.
you notice
okay.
when that happened for you?
Sorry.
What do you notice when that happened for you?
He's trying to do the
Just-
psychotherapy for you now.
No, but when I was a kid, yes, I used to think a lot about what I'm going to do the next day. Oh, yes, this is going to happen. This is going to happen. Oh, yes, this is what I want to do at school. Oh, yes, would I be exactly like what you said? And then you go, oh, hang on. It's in the middle of the night. Everybody's sleeping. I'm not sleeping yet. Why am I not sleeping yet? I should be sleeping right now. So why am I? So then you just start thinking about. Then you become so aware of your awakeness.
Yeah.
Yeah.
Yes.
Right. And then it just becomes bad. And then you look at the clock again and go, "Oh, it's been 1 hour since I've been awake." Now, it's very stressful. And then I will have to be awake in 2 hours' time. What if I can't sleep again? Right. And then so it's and I'm assuming a lot of your clients are like this.
Yes,
So
that's true.
the hardest thing is to break that pattern.
Yeah. So how do you how do you advise your patients to break that pattern? Because
I think,
for
yeah.
me, I'm like, if I'm gonna do that, what usually happens is that I would just say, okay, I'm gonna stop sleeping, like trying to sleep.
Oh, yes,
And
yeah.
just go read a book or something like that to like
So
break
you
my
get
mind.
out of bed?
Yeah, get out the
Yeah.
I don't know whether that's correct.
In a way, yes, it's true. So I think, what I just described for both of you, is this hypervigilance towards sleep itself. Right? So much so that all people could see is sleep, right? And the lack of it. And that gets people really, really anxious about it. Right? So the more we want it, the less we have it. And it's
Oh, that's
not
so
a
tough.
very comfortable feeling, isn't it?
Yeah.
It's a very Buddhist thing, right?
So I think that's where I think, like I mentioned, right, the first part is that awareness, right? The awareness of what's happening here, right? And what do we actually feed our minds with? So do we
So what
feed
do
our
you
mind
yeah,
with
what do
more
you feel
thoughts?
with it? Yeah.
And I think the key part is recognizing that, the more we want sleep to happen, it's not going to come for us. And what can I do instead that is nourishing and engaging for myself? So rather than having my full attention, my 100% concentration on trying to get that sleep, can I use the time to focus on something that's nourishing? Something that I perhaps didn't have time for in my very busy workday. That I can now begin to find that joy in engaging with it. So
like happy
noticing
thoughts.
that shift, right,
Yeah.
from a doing state. So a doing state is essentially, we are doing something to get something.
Yes.
So when we get so caught up with it, we no longer see and be aware of what's already here. So a key part is to kind of let go of that drive of, I need this certain number of sleep, or I need to sleep right now, and then begin to shift our attention to something else, something that I can nourish my body at the moment itself. And for example, like what you
that's
just
interesting,
mentioned, right?
yeah.
Like reading a book, that
Yeah.
helps. I wouldn't really recommend reading the news, especially
like
right now.
you read about wars. That's gonna be
correct.
more
So that's
agitated.
what I meant by, what do we feed our minds with? I have clients who would initially, when they come to me, they say, hey, Eric, when I can't sleep, I'll start reading the news, right? I will check out, what's happening all around the world. And what I read is, about this devastating impact of, the
Humanity
bombs, right? Or negative
Yes.
events that happen all around. And that just doesn't make him feel more at ease, isn't it?
Yes, the last time I couldn't sleep was because I watched The Nun. The horror movie.
Yeah.
Yeah.
So watching horror movie isn't such a
No,
good
not a
idea.
good idea. Especially when, you see the face of the nun in the dark. Yeah, so okay, that's quite clever.
Okay.
Actually, there was one thing, it was so coincidental. Today, I had a patient that spoke to me about her extreme difficulty of going to sleep. And she's seen psychologists before. She's even seen a psychiatrist because she actually needed pharmacology to help her, right? So she's on a couple of medications to actually help her sleep. And so and it only helps her to some degree. And she is truly a very anxious person as well. So I think that's exactly what you were saying, that she was so focused on, this is bad for me, that I'm not being able to sleep, and it's making me so worried that I cannot sleep. Yeah, so definitely be sending her over to you. And the other thing also is that I was talking to her about how sleep, or the lack thereof, is very linked to stress, right? So your stress levels go up. We definitely see that even one bad night of sleep, you get high blood pressure, your breathing's not very good. You certainly will be more prone to getting infections. And certainly what we see is the link to definitely inflammatory gum disease issues as well, right? And so that was something that we were trying to advise her about, is that, you can't treat a disease in your body without also managing the sleep component and the rest component, because everything else will just you won't be able to restore yourself if that's the case. So I think why we were so interested to having you here today is that we're trying to look at the body very holistically.
Yeah, I mean,
In a multidisciplinary sense of, if we get patients that have these issues, and sometimes just by saying to them, we do this treatment, you'll be able to get a result. And we definitely don't see that happening unless
traditionally a lot of dentistry, coming from us, is that we are trying to fix a problem that's already done. Like, the tooth breaks, or there's a lot of wear on that tooth, or the tooth is decaying like crazy, and then you fix it, and you're like, okay, that's done. But it's not really fixing the root cause,
the origin,
which is like maybe stress related, could be sleep related, could be gastric related, that is causing the teeth to show signs of damage. And so then we will just repairing the damage. But if you don't repair the root cause, then it's going to come back again, or in some form or other. So that's why we really want to have a look at the body as a whole and treat that as a whole. I guess.
For sure.
That's an important bit for me.
Yeah.
Okay, another question for me. If you are snoring, does that mean that you cannot have insomnia? You know what I mean? Because I was thinking about it, because
While you were sleepless?
is it like is insomnia like can you be like half insomnia? You know what I mean? Like half asleep and then you still like thinking about it.
Oh.
Like you're still like conscious sleeping. Like, you're not deep sleep, not deep REM sleep kind of thing. You know what I mean?
Sometimes people do tell us that, even though they slept, right, but they wake up still feeling not well rested. Right? And I think that part of it is also because the mind is still working really hard to process the events of the day. And I think that's where, one of the things that I always share with my clients is, it's very important to take care of our day, to give ourselves sufficient time to decompress in the day, rather than to kind of leave it all the way to like the last 1 hour before we go to bed. Yeah, so I think that's where, sometimes the mind just get very caught up, in many of these thoughts, trying to process the thoughts, the emotions of some of the events that happen in the day. And I think that's where it's really important to kind of address that upfront.
Okay, cool.
Oh, interesting.
And do you like prevent them from telling them, hey, don't, no, blue screens, I heard, is not very good for sleep? Is it true?
But I think what Eric has been saying this
It's
whole
more about
time is
mindfulness.
that, yeah, don't care about all that.
It's don't care about all that.
Right?
Because the more you care about it, the worse it becomes.
Correct?
Essentially.
So I guess the key
In a
part
way,
is,
yeah.
are we too over vigilant about it?
Yeah, right.
Right.
Like, yeah,
so
you know what I
much
mean?
so
Like-
that, you know,
Okay.
when you're engaging in it, you're so caught up with like, oh my God, I shouldn't be doing this. Right?
Yes.
So Eric is the anti-steps of
Eric's like, okay,
going to
no
sleep.
rigid regimen, just natural.
Yeah, right.
I think the key part, like the one of the simple tip is, you know, to let go of the perfection that we have when it comes to certain sleep rituals. Or
Okay.
you know, adhering to some of these sleep hygiene's tips out there.
So there's a lot of different schools of thought on this.
So this is amazing.
Right.
It's very fresh.
Yeah,
Like
because
what
like
you're
there's
saying.
some like people like, okay, you got to do this
Yeah.
before you sleep.
Yeah.
And then now you're saying that, hey, it doesn't really matter as long as you can get quality
Yes.
sleep from whatever, you know, whatever natural means is possible and your mind is clear to sleep.
Yeah.
Am I right to say?
Having
Yeah.
a routine is helpful, but being too overly rigid is not.
Yeah.
Yes. Okay.
Yeah.
This is a very good way of putting.
So would you say a lot of people who have OCD issues will have insomnia issues?
I can't
Have
comment.
you no can't comment? you don't quite see that. Is there a, I mean, obviously it's our kind of personality type
Yeah, I
seems
mean,
to have the sleeplessness, right? Yeah.
Is it okay? Is it a lot of high performing individuals usually having insomnia? I think that's
More often than not. Yes.
more often than
Yeah.
not.
So
Okay.
for many of clients, they're either like executives, CEOs,
Type As.
leaders.
Yeah.
Right.
Some yes, with type A personalities. So they're very hard on themselves, right? Because they achieve they only want the best, right? And
Yeah, perfectionism kind of thing. Okay.
it's good, right? But I think it's also important to recognize some of the challenges that comes with that, right? And especially when it comes to sleep, sleep isn't a performance to be perfected at.
Understood.
That's true. Yeah, that's a good way to put it that way. Yeah.
So if we go to bed thinking that, hey, I need to hit my KPI of, you know, having like
7 hours
to
of
9
sleep, 8 hours of
hours
sleep, yeah.
of sleep, right? Then that's where, you know, before we even lie in bed, we really put ourselves
Hey,
in
but
this
that's what the
unnecessary
that's
pressure.
what all the fitness watches and all that stuff is having, right?
Yeah,
you have
yeah,
the hours
I
of
know.
sleep and everything
I know.
that you
It's
like,
making me depressed. Really.
In fact, there's a condition called octosomia,
which is
which means people are obsessed
With
around
sleep.
getting that perfect sleep score.
oh,
I need to perfect my sleep.
You mean
right? I need to
someone called Brian Johnson?
oh, cool, yeah. Because I used to have this ring that will tell you the score.
Aura ring?
Yeah,
Is
yeah,
it Aura
and then like you put it on and then you're like 98 or
Oh.
like 90 and like, oh man, like how can I get 10 more points?
Yeah, so
What was
sometimes,
the
you
thing?
know, when people wake up in the morning, they look at the score and it makes them more stressed. So I think it's very important
Yeah.
to kind of examine what's our relationship with sleep itself.
Yes.
You know, are we expecting too much from it? Can we be kinder? to sleep?
Kinder to our sleep. Yes. Actually, I did this morning. So I track my heart rate when I sleep. So I know if my heart rate is higher, that means I didn't go into a deeper sleep, right? So this morning, I woke up going, I think I had pretty good sleep. Looked at my watch, went, oh, not that good. So I think I am I think I have to come and see you with the mindfulness. Yes.
Oh, that's pretty cool.
Yeah.
Like, I didn't know that there's so much more to insomnia than that.
Yeah,
And does alcohol make it worse
Yes.
or better? Because people say, oh, I will drink myself to sleep, right? They say, okay, I have a couple of wine and then I can it's sleepy and I sleep. Why is it not good? Like,
So alcohol does help you to sleep more easily. It's true. But what happens is that it actually affects your sleep architecture. So what happens is in the first half of the night, it actually suppresses the REM sleep.
okay,
And
so you're
then
more alert-ish or what? Does
You
it?
actually in the first half of the night, you kind of like really get that kind of nice sleep.
Oh, okay. You get a nice sleep. Okay.
Because it suppresses the REM. So actually, when we go through the different sleep cycles, like the REM state is part of it. Right?
Yeah. The rapid
But
eye
what
movement.
happens when we take alcohol is that it affects the second half of the night as well. So if I remember correctly, is this idea of like REM rebound. So there's more episodes of REM
Okay.
in
So
the
you don't
second
really.
half of the night. So it's actually not that restorative. So people find themselves waking up in the morning feeling less well rested when they consume alcohol.
And this is like, is it contributing to being hungover?
Yeah.
I think that's essentially it, right? Okay.
Yeah.
Oh.
Yeah.
And is that the
Oh.
same for something like melatonin, or not really? It's a different story.
Different.
Yeah, right.
Yeah.
Okay, so it's alcohol related. And caffeine, stimulants.
Sorry, man. You're asking him like all that pharmacological stuff.
He's like, just don't think about it. All right.
I guess like from the mindfulness perspective, which is something that I focus more on.
Sorry, Eric. Sorry.
Oh yeah, I think we're
It's like,
barking up the wrong tree. Yeah, sorry.
It's also noticing, when our alertness level drops. Right. So very often, people take caffeine, when they feel like they're getting very sleepy in the afternoon.
Mm-hmm.
Right. Or when they need to get through the night because they have not completed some work. Right. And that's when they feel the urge that, okay, I need to consume some caffeine to get me going. So even though they need the sleep, right, to kind of get through and prepare for the next day,
Just blocking
sleep
it out.
becomes sacrifice, right, and replaced with caffeine to keep us going, right? So in our pursuit of productivity, in our pursuit to get things done, sometimes consuming caffeine can actually get in the way.
Yeah.
Right, because I think at the end of the day, we probably want to reflect and ask ourselves, is the quality of the work when I kind of work on it at night, is it still of the similar quality as compared to when I get my well-rested rest? Is the output still of sufficient quality that I can confidently say that this is good?
It's like, he's like you're really changing people's mindset about sleep, it's not really a score. And also at the same time, like, I think that people always want to try to strive for perfection. That's the main issue, I think. And then I think that's very Singaporean.
Yeah, it is.
To be very successful, you gotta you gotta really push a lot, and then you don't think about sleep so much, things like that. And then at night you need to be thinking about sleep, thinking about your work next day, kind of thing. That's a very Singaporean mentality, I would say. I think even in school I was brought up that way as well. I'm sure you were also the same. So that's interesting. That's really good. But like in terms of like, you're talking about mental state before you sleep, right? And there are times where there's like deep rooted issues with the person. Like, for example, he has this very big issue at his house, things like that. That is like, his family has issues, things like that. That is preventing him from sleeping well because it's like sort of thinking about it all the time. How is it gonna be tackled by you? Is it very difficult to tackle? Because it's not just about work anymore. It's about something more deeply rooted, and like unless it's undone, which is gonna be very difficult to do it in the first place. Then how do you try to tackle that sort of psychology?
I think the first part is to kind of examine what's their relationship to the stressor. So there are different kinds of stresses. I think one that we mentioned earlier is that of work. The other one could be more family related, right? Some it could be health as well. So when someone has like poor health, it makes them more susceptible to feeling more stress, right? Where they begin to think a bit more about the consequences and what are some of the longer term outcomes of that. So I think the first part is kind of like unpacking that and letting them be aware, how is this stressor affecting you at the moment, right? What aspects of this stressor is that you do actually have some form of control over, right? And the other part is, what are some aspects that you do not actually have any control over? So beginning to unpack and begin to see clearly, are there ways that we are adding on to it that is not helpful as well?
Is there a personal story that you can share with us? What actually got you into this mindfulness and this especially with the focus on sleep?
So a personal story that I would like to share here is actually dating back to more than 10 years ago. So when I was 23, I was unknowingly and unexpectedly thrown into the role of being a caregiver for my dad. So I was in my final year of university and I was doing my degree in psychology. And I received a call from my mom one day, and she said that, my dad fainted at the void deck. I rushed home and realized that, he wasn't too good. Rushed into the hospital and later found out, after waiting at the A&E department for a couple of hours, the doctor came out and he said that my dad suffered a stroke. So that was the day that changed my life completely. I never felt so stressed before, knowing that I needed to care for him. And I think that's where it really started my whole journey in the area of mindfulness, to really sit with this discomfort, to sit with the responsibilities that are being placed on me at a young age, and to care for my dad, who has brought me up for so many years. And that also kind of motivated me to join a mental health charity when I first graduated. So I joined a mental health charity in 2014, and that's when I embarked on a role of mindfulness as a mindfulness psychologist back then, and really beginning to go more in depth in this area. And I find that it's very rewarding because, as I learn more about this skill and teach about it, I myself as a caregiver also benefited a lot and immensely from it. Yeah. So, and I think it was really through these 6 years of caregiving for my dad that I really struggled with sleep myself. So there are many nights where I'll lie on my bed and my mind will go thinking about, what's going to happen to my dad? How long is this going to last? How is he going to feel? And I think the most stressful moment was when my dad got diagnosed with vascular dementia after 3 strokes. That was the toughest time I ever experienced, because bit by bit, day by day, my dad was losing parts of himself cognitively. He wasn't himself. He began to experience lapses in his memory, changes in his personality, became more irritable. And that was when I knew mindfulness was really an anchor for me, to sit with this huge change of emotions and to serve with that, and to accept that this is one reality I can't change, but one that I have to accept if I want to move forward.
Yeah. Oh.
Thanks for sharing.
That's awesome. So, on a different note, I understand that you're also into the hotel space now as well. Would you like to share with us?
Yeah.
How's that possible?
Yeah, it's something amazing that I'm very happy to share that we actually partnered with Como Metropolitan Singapore, a luxury hotel here in Singapore, where we work with them very closely to offer our sleep health screening services for their hotel guests. So this is a program that we collaborate with them. It's called the Sleep Dreams Package. And that's where guests can stay at the hotel itself for 4 days and 3 nights. So before they arrive at the hotel, the guests actually get to do this 20 minutes Somnus Sleep Health screening before arrival. And upon reaching on their first night of stay, they are greeted with a suite of different devices. So actually not different. One device actually. It's called a sleep hub. So it's placed in the room itself, and it's designed to help the guests to sleep better throughout the night. It also has eye masks. There's a tea that's specially formulated to promote better sleep. And I think it's really interesting because it's in line with this trend right now, which is sleep tourism. So more and more travelers are prioritizing sleep as a goal, as a priority for themselves when they travel. to get a more restful state of sleep so that they feel more rejuvenated and refreshed. So what's interesting is also like in this package, they have contrast therapy. So people actually alternate between ice bath and infrared sauna. And they also have an experience to go into a oxygen hyperbaric chamber for 1 hour. So
Wow.
this is all part of like Como Shambhala offering as well. And it's really
wow.
quite interesting,
Wait,
that more and more people are looking into this and prioritizing it.
So it's
As a
like a
form of
retreat
wellness.
for sleep wellness.
Yes, it is.
The hyperbaric chamber sounds amazing.
Yeah, sounds like that's the one we use for diving, right? After if you like decompress.
Yes, yes.
Yeah. Wow. Okay. And West Como Hotel, that's at Orchard, right?
Orchard, correct.
It's a new hotel, right? Am I right?
Relatively new. Yeah, relatively
It's
new.
near our
New
clinic.
clinic.
Yes.
We
Just-
should
Oh yeah,
say,
you
pay them a
recently
visit.
opened
We
one,
just opened
right,
at
in
Orchard. Yeah.
right?
This month.
Yes.
So
Yeah.
Congratulations.
yeah. So I use that road to exit because that's opposite Paragon. Am I right?
Correct.
Yeah. Okay. Yeah.
That's
I know
right.
where is it now.
Oh, that's the one. Yes.
Yeah.
yes. Okay.
There's a like a bakery there that's very popular.
Yes, Cedric Gole.
Yeah. So okay, cool.
Okay.
So like if how can we find you? How do you do one-on-one sessions or do you do masses?
So one thing interesting that we started to explore is actually group therapy. So at present, most of the time we do one-to-one consultations with our clients, but we recognize that some people can also benefit from a group therapy from what this intervention that we call cognitive behavioral therapy for insomnia, otherwise known as CBTI.
Connective behavioral.
Cognitive
Be-
behavioral therapy for insomnia.
okay.
Yeah. So that's pretty much what we do for our clients. It typically takes over 6 to 8 sessions. And that's where it's a more lasting treatment to help people address the root causes of the insomnia. And a group therapy also works the same. And people can get the similar therapeutic effects even in a group setting.
Do you go to where they are or they come to you?
At the moment, they come to us.
Right. Okay.
Yeah, but it's something that we're also exploring more with companies as well. So one thing that we're exploring at the moment is to work with companies to actually screen their employees for potential sleep health issues, especially insomnia. And that's where we will offer a group-based therapy for the employees, and companies will be invited to perhaps explore a co-payment scheme where employees will pay a segment of it to get some of these sleep issues treated. And when employees sleep well, they
more
are actually more
productive,
productive
yeah.
and they are more happy and they are more engaged in their work as well.
This is a silly question, but do any companies go, ooh, can you screen this potential employee? Very bad sleeper. Okay, we won't employ this employee.
No.
Possibly. Wow, that's pretty cool. I mean,
Yeah.
that's so. I want to know. I think the viewers also would like to know is if they see you, do they have to share like confidential information? Because some people might not be wanting to share all these things with you, like unpack. And so is it like or is your teaching method like a generic sort of like methodology rather than like unpacking your load kind of thing? You know what I mean?
And that's for us, we don't force our clients to share what they don't want to.
Yeah.
Right. And I think it's really important to respect the boundary, to respect their privacy as well. So really asking and inquiring in a way that can best support them, in the challenges that they face, and to equip them with the tools, right, and the skills so that they can sustain these healthy sleep behaviors for the rest of their life.
But I guess at the same time, I'm assuming, Eric, that you would have to ask the questions still, right? You go like, would you mind to share?
Yeah, for
Yes,
sure. So I
yeah,
think
no,
at the
please.
start, we will reassure them that, whatever that we speak about in session is confidential.
Yeah.
Right? It won't be shared with any other people, right? And that is really for the purposes of them meeting their therapy goals. Yeah, at the end of the day, to help them to get back that satisfying sleep that can support them to thrive in their lives. Yeah.
Okay, that's pretty cool.
Yes.
Okay, I got one more question. I got so many questions today.
Keep going.
I'm like
Keep
firing
going.
away. If you have any questions for us, please feel free.
Actually, I do.
Yeah.
Yeah,
So
yeah.
I'm curious to know, right?
Okay,
like,
yeah.
you know, in your role as dentist, right? And also, for example, you know, as a business owner as well. Like, how do you what are some of these like sleep challenges that you experience, and so maybe do you observe that in the patients that you see as well?
You want to answer that first?
Yeah, sure. I consider myself almost like a partial hypochondriac, in the sense that the more you learn about something, you go, oh, I've got that. Oh, I've got that. So to be honest, yes, we see actually a lot of these issues, and I'm just backtracking from when I was a younger dentist, and just realized that a lot of these things can be easily missed, I think. And oftentimes our patients don't even know the links to different aspects. So one of the interests that have really opened my practice up with general practice especially, is to see the interlink between sleep, breathing, and dentistry. And so we are a tiny cog, but I think a very important recognition point to be able to then disclose to the patients, oh, this is what we are seeing. And we associate this to breathing issues and therefore also sleeping issues, and triangulate it in a sense that, yes, you came in with a dental issue, and I can treat you with this dental issue, but you really need to look and explore with a doctor and maybe an ENT about your breathing, and because that's definitely affecting your sleep, and your sleep is affecting the disease that you're having in your mouth. So although we can fix that part of your teeth, and you may decide as a patient to only fix this, just bear in mind that there are all these other aspects that also then trickle into, your high blood pressure, and we see it. So when I do a history with a patient, we can almost look into a crystal ball and say, this is what's going to happen to you. And a lot of them are very amazed.
Yeah, it's pretty cool.
They say, oh, how did you know this about me? I'm like, I don't. But we see the patterns in your mouth.
I mean,
and
it's
it
like
becomes a
one
reflection.
of those things where you discover a skull from somewhere.
Yes. Yeah.
It's like, and then you like, okay, like the person eat a lot of vegetables, a lot of meat, and
Yeah,
like you can
yeah.
see whether it's undergoing a lot of stress.
Archaeological.
Yeah,
almost,
it's like a
right?
forensic sort of
Yes.
thing.
Yeah.
And like, like Neanderthals, you can see, like it's really, the teeth are very broken down because the
Yes.
diet was really full of sand and stones, things like that. You can see stress, they can see like, damages to the jaw, things like that. So it's like playing detective in a way. You can actually see things unraveling, and because we take photos for all our patients, and we do like photos 5 years ago, and every time we take photos, and so I have like analysis of like 5 years ago how the teeth look like, and then 5 years after, and then you can see like the amount of destruction or non-destruction over there, and you can say, okay, this is something's happening there, and your body is sort of trying to compensate for those sort of stuff. For instance, grinding could be a pattern of stress, but it also could be a pattern of like a sleep disorder, because when you're grinding, you're trying to open your body's way of opening the airway to breathe better.
Yes.
And so yeah, that could be also because of insomnia, where it's stress and you're grinding your teeth, things like that. So multiple stuff. And so it's like a good way to peer to the future and back.
Yes.
Oh, let's say that.
Very, very
Yeah.
much true. Like you can project, right, what's going to happen in the future. And some people are more committed and invested into looking at preventative measures, and others actually just go, oh, this sounds very woo-woo. Like, some would say, I don't really think that's relevant. So it's quite interesting. And so we have a very large array of different patients, but definitely I see a lot of families, and the parents are much more aware of it in their children as well. And so then at least they're very mindful and they keep an eye out for what's happening with the kids. And so we tend to then just be the teacher or the guardian of that and just say, okay, these are the things that you can look out for and come to us, and we will then discuss with what's actually required. But it is a sign that something else is happening here. And what you were saying, Justin, is that if you've seen a patient for the last 10, 15 years, let's say, we sometimes would see no disease issues for a long time. And all of a sudden, there will be like a burst of problems. And you can just say, oh, this looks like it
what
could be
happened,
stress related. Yeah. Suddenly you've got so much inflammation before you
and
did
then
it.
usually you'll say, oh, my mom is not
Yes,
healthy, or
that's
something
right.
like that. It's not, or like I just had a job change or things like that. And you're like, that's
very, you can almost time it, right? So then I think just out of curiosity and being very aware of these issues, then
I think we just need
realize.
to see it as a dentist. Just try not to see people like just to fix teeth.
Yeah, that's right. Yes. The mouth is
It's like,
somehow connected to the rest of the body.
Somehow or related.
Yeah.
It is so, because I feel like, for dentists, the very important work that you do, and so many patients that you see day to day, right? Like just peeling through the mouth opens the gateway to exploring so many other things, right?
For sure.
And that you can advise or even empower your patients with knowledge to seek the help that they deserve or could benefit from.
Yeah, so like for us, the biggest thing was taking photos, because like it's so visual that you see it, like, okay, you believe it. Like if a dentist comes to you and say, okay, I think you have sleep issues, it's a bit like hocus pocus, you know what I mean? Like it's like, guys, sell me something,
yes, yes.
So like we gotta show like data, and the best way of showing data is like taking photos, right? And like doing a scan on an X-ray to like show the data and like, oh yeah, this is really happening, this sort of stuff. That's our biggest take home.
Yeah, and I love that Justin is such a he's
I like photography.
he loves photography, so
He likes photography as well.
Yeah, I enjoy photography as well.
Yeah.
So the practice is decked out with
like
all the
cameras.
best cameras and very big screens, right? So actually today I just share with you guys an anecdote. So it's a patient of mine that I've seen for a long time, but we've created a new protocol where we take pictures and we put it up on the screen. And we have a 55-inch TV in front of us, right?
Yeah.
And so I say, okay, I've taken some pictures. I'm just sliding them into the big 55-inch TV. And she goes, do I really have to see this?
Yes.
And then, yes, the everything just completely changed to self-motivation, because she looked at it and went, ooh, that doesn't look very good.
Yeah.
And I have to almost reassure her, that's actually okay, but there are some other things that we are really observing. We're observing the wear on your teeth. And you can just see so many things, right? It's like the first time when the microscope was created, people just, people didn't know what germs were before, right?
You're right. Yeah.
And so there is a whole world in there, and so this is fascinating with the sleep.
But I think Eric also was alluding to the fact that with like as healthcare professionals, how are we affected by with bad sleep? That's the thing.
Personally,
it's a lot, right?
Yeah,
because
yes.
I think as like for us, like especially dentists, I would say,
we're a
compared
bit
to
OCD.
medical, no, but like the notion of like it's a very commodity driven like healthcare profession.
Oh,
Like don't you think so? Like if patient pays for a filling, he thinks that the filling is the best. Like you get a filling, all right?
Right,
But in
right.
healthcare, it's like I'm gonna do a transplant, and there's like an 80% chance that you might be successful, 20% chance not successful. But that's the way it is, right? But then in dentistry, it's like, okay, you're gonna do a filling, you gotta do it like perfect, like 100% of the time, and we know it's not. It can't be. It's not. There's statistics around there and things like that. So it's not gonna be there. But like, it's so commodity driven that, and even Invisalign, right? Because that's a big Invisalign, where it's a form of braces, form of teeth straightening.
Yeah.
But people think that Invisalign is the same product from one dentist to another dentist to another dentist to another dentist.
So it's very result driven.
It's very
right?
result driven, yeah.
Yes, yeah.
And so because of that, like it adds a lot of stress because like dentist needs to be like geared up to 100% of the time to do well, which I know it should be because you need to do it the best you can do, but it's just unnecessary stress. So we as
It's true.
It's really big, I think. Yeah.
It almost feels like you're part contractor, part engineer, part physician.
Yeah, and artists
Right.
and everything. Yeah, because you got to make it look nice, things like that.
Yes.
And then, but you got to remember it's a human body, right? And like, it's and not just teeth. Like if you do like surgery, like if you're cutting the gums, things like that, and then it's like a living thing, right? Like there's blood, and there's a patient has an underlying medical condition or not
Yes.
even known, but then you are expected to get like 100% success rate all the time.
Yeah.
And so for me, that was a big part when I was starting off as like a budding dentist. I mean, I'm sure you also had nights where you just like you have a procedure the next day and you're like, okay, I need to run through everything. That it needs to be perfect, blah 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 blah. But like sometimes it's just, and even now sometimes I have to run through everything. I sometimes get nervous, but I know that I'm okay. But it's just that because it's a variable thing, it's a human body. You need to make sure that you are sort of a bit of nervousness is also good, right? Because then you'll be on your toes, and then you make sure that it's okay. You don't want to be complacent.
You
about
run
it,
on
right?
adrenaline.
Yeah, you don't want to be complacent on, because once you are complacent about it, things fail, things can have errors, right? But that's the whole. That's not
Yes.
really adding to my psychology of sleeping. That's what I was gonna say.
Justin.
Do you agree with that?
Oh yeah. I agree with it. Yes.
That's-
Yes,
yeah.
I agree. Yes.
Yeah. So
Yes. Yeah. Why are we in this profession?
yeah, man.
Thanks for sharing, because I feel like, what Justin just mentioned, right, is there's this level of unpredictability, right, when it comes to dealing with like the patient, right, and that you're always expected to do your very best, right,
Yeah.
to produce outcomes that the patient would want. And I think a key part is, just noticing how much of this thinking, can actually get in the way of you feeling well rested, right?
Yeah.
Before you perform
Yes.
that procedure the next day, the next morning. And I guess at the end of the day, also recognizing that, each one of us here, we are only humans, right? And that there will be moments that we may not be the very best that we are at. And to remember that sense of compassion for ourselves as we move along.
Yeah, for sure. And Eric pointed out something earlier that has actually helped me sleep very well, which is that you said, when you have gone through the day and you were productive during the day, and that's kind of like I'm paraphrasing what you're saying, but the gist of it is that you've done your best for that day already, and then I can actually let it go. Yeah, now in my middle age now, I don't ever go, oh yes, I should have done this and this, if I know that I've done my best. It's only when sometimes I would just reminisce and just go, ooh, actually I could have done this a little bit better. I would have been more vigilant on this, and then an outcome will be a little bit different, right? But when you've done your best, that's actually when I sleep the best. Yeah, also because you just go, oh well, I can now rest.
Yeah, and I think that's so important, right? To even give ourselves that permission, right? To acknowledge the work that we have done, right? Putting our very best efforts, and to assure both the body and mind that it's okay to let go of the day now. It's okay to...
You're very soothing voice, man.
I'm about to cry.
It's like he's releasing us from the set.
Yes, releasing us from our burdens.
Yeah.
No, but that is so true. And I think it needs to be like mindfulness of restfulness, right? Pretty much. It's like
it's something that I really feel strongly for, about how rest should not be seen as a good to have, right? But something that should be built into our day-to-day moments, if you want to go the distance.
I forget who said this, but it was a physician that said humans, out of most creatures, is the one constant that 1/3 of our lives need to be sleep. And and if you think about it, for the most productive of animals and species, like with mammals, other mammals as well, like lions, they just 90% of the time they're just resting. And then, right, this is lying
just
around, and then
yeah.
there's prey, and then boom, they are very productive, and then they go back to just resting.
Okay.
Yeah. So
That's true.
that seems to be. Or Jeff Bezos, right? He has like one meeting and go, well, you're Jeff Bezos, you can do that. I don't think I can say to Justin, hey, I'm just gonna see 1 hour of patients today. And that's it. But yeah, it's just, I think juggling modern life is very, very challenging. And I think social media doesn't help either, right?
Yeah, I was just gonna say
the
that.
FOMO, the YOLOs.
Yeah, and like I think this is happening a bit to me sometimes as well,
Okay.
like death scrolling.
Oh, really?
Like,
Okay.
yeah, and at night when you like the moment I know that I can't touch my phone at night. That means once I sleep and I wake up, I cannot touch my phone because once I touch my phone, I'm gonna be like scrolling it and like just doing like things that other than being mindful about sleeping.
Yes.
And then that's just being
Yeah, that's true. I actually deleted Facebook.
really
Yeah.
wow.
Yeah. It was hard to do at the start, but I just thought, you know what, I'm just going to delete it completely. It was partially a mistake. I just wanted to get rid of it on my home
You really
page,
saw
but-
as if it's like really like
No.
really did
It was,
purposely.
it was my, I wanted to hide it so that it was very hard to find. And then I accidentally pressed on the button like, are you sure you want to delete? And I said, yeah, it's delete. But then I realized I deleted my whole account.
Oh, your account.
Yeah,
wow.
my account
Okay.
it was deleted. So like I can't get back into it anymore. And then it took me a week and I felt very anxious about it. And then after that it was, actually I can do without it. Life didn't end.
Yeah.
Yeah, so a lot is happening, I'm sure, in Facebook, but I'm not aware of anything that's going on. Yes.
That's
None the wiser.
really interesting.
Yeah.
It's true, you just when you mentioned about doom scrolling, right?
Yeah.
Like we just can't help to stop, right?
Yeah.
And
And it's like really useless stuff. Like sometimes the videos are just useless. Like you can't like there's no informational thing.
Yes.
Right. All right.
And suddenly it's 1 hour later.
Yeah. Yes. Yes.
and that's where we realize that we trade off our time
For sleep.
for sleep.
Yeah. Yeah.
And then you go, I've got 30 more minutes, I've got all this work to do, but I need to sleep.
Yes. Yes. No. When you doom scroll and then after that you have less time. You say I gotta sleep now. Then you get more stress to sleep and you can't sleep.
Correct.
Then
So
you rather
the
sleep.
time pressure
Yeah.
makes
Yes.
makes sleep even more elusive.
Yeah.
Yeah.
Man,
Yeah, this is our therapy session with
that's
Eric, I
that's
think.
a good therapy session today, man.
Yes.
All right.
Yes.
Okay. Anything else to add before we end this?
Yes.
the
Perhaps we can help you with something dental.
Yeah, I
Quid
think
pro quo.
it's important to kind of just pay attention to the way that we view sleep, right? And to let this process be as natural as possible by seeing, what can we do to support it and also to unpack some of the barriers that get in the way.
And how can we find you? Like if someone wants to find you, how can we find
The
you?
best is to go Google and type in Somnus Sleep Wellness.
Right.
And we'll be happy to schedule a 15 minutes free consultation to kind of walk you through, what some of the challenges they experience and to suggest a solution for you.
Maybe before we end, I just want to know how's the consultation like? Is it like what do you do on the first visit? So that
Normally, before the client comes for the first visit, we will normally send them a intake questionnaire form. So we'll try to get to understand them first and some of the challenges that they face.
is that the same as the
The sleep health
different.
index.
Okay.
Oh, it's different.
Yeah.
Right.
So on arrival, what happens is we will meet them. So we actually do have face-to-face sessions and teleconsult options if they choose to. But if let's say it's face-to-face, we'll meet them and for the first up to 90 minutes, we will try to understand, take some history taking, understand the background issues, and also to understand, some of their goals for coming for this session. to see how we can better support them, making adjustments for their sleep habits and to address, some of the key concerns that they have. So very often if it's insomnia, that's where we'll continue to support them. If it's other stuff that's more medically related, that's where we'll refer to our partners. Yeah, so I think like in the subsequent sessions, that's where, normally after the first session, we'll give them a sleep diary. So we invite the client to keep track of their sleep. So for example, what time they go to bed, what time they wake up in the morning, how long they think that it takes for them to fall asleep, as well as how long do you think that they are awake in the night itself. Yeah, so this helps us to kind of gather the important data points to suggest to them, what are the better options to kind of get them to get their sleep back on track. Yeah, so one of the key principles that we use for people who experience insomnia is this thing called sleep consolidation. So very often people who have insomnia, they spend a lot of time in bed actually not sleeping. Yeah, so one of the things that we measure is sleep efficiency. So for example, if let's say, they are 100% sleep efficient, it means that if you spend 7 hours in bed, 7 hours actually spent sleeping. But not many people have that.
I mean, that's like...
the moment. But it's also not so good, right? Because it means that person is very sleep deprived.
Yes.
Yeah, because the moment you lie down and you fall asleep, you're super sleep deprived already.
I think there's a study that shows that it's about 20 to 30 minutes, right? Of bed.
Yeah.
Oh, really?
Like you gotta lie on bed on 20 to
normally,
20 minutes.
On
Takes
average,
me about
it's
5.
people about like 15 minutes.
15 minutes on average?
Yeah,
Okay.
on average to fall asleep. Yeah, so I think that's where, what we do is really engage in this very data-driven approach to gather data points from our clients. And then we will suggest to them, what is the ideal time to go to bed. Yeah, because we don't want them to spend too much time in bed that's not spent sleeping. Yeah, so that's some of the key principles that's involved.
And how many sessions do you usually do per
Normally
client?
about 6 sessions
Okay, and on a weekly basis?
on
Is
a
that-
weekly basis.
Okay.
Is it done like close to nighttime?
No.
It's just any time of day.
You
can't do it.
working hours.
It's like he comes to your bedroom.
Yeah, but I think
Now be mindful.
what's important is to realize, right, is that, once they do this, oftentimes they will experience the effects for a long period of time. Yeah.
Because it's a philosophy thing. It's not like...
Correct. So it's really
therapy, yeah.
addressing the root causes.
Yeah.
As compared to maybe taking sleep medication, which is a more long-term kind of solution.
So if it's like 6 visits and like they're cured, is there like sort of a maintenance program that you put them on like every 6
Every
months?
year
Like dentistry, that's like 6 months
That's
you
a
gotta
good
clean,
idea.
3 months you gotta clean
Yeah.
to
At
reflect
the
a
moment,
refresher.
we don't.
Yeah.
At the moment, we
Review.
don't. But I think what's important, is for them to kind of continue to manage the stresses in their life.
Okay.
Right? Because sometimes, certain stresses can be of a bigger magnitude. Right?
Yep.
And, being supported in that way is very helpful. Yeah.
Oh, wow, cool.
Yeah. So in fact, we have this other offering, which is the mental fitness club.
Oh,
Tell us more about it.
yeah.
Yeah,
Sounds
so
like
I think this
Sounds
was
quite
like-
sounds like
tiring.
he's got KPIs.
Yeah, sounds like pretty tiring, man.
Fitness.
So oftentimes, we think of like strengthening your body by going to the gym, right? By exercising, right, to stay physically fit. But how about mental strength? So when things get challenging, for example, when my dad was ill, right, it was very easy to question, why me? Why does this have to happen to my dad? And that's where mental resilience is probably something that I lack a fair bit. And I find that, if this is something upstream that we can all begin to prioritize, to learn ways to cope with the stresses in our life, to manage in ways that is more sustainable, to understand the reactions that we have, and to find better ways of coping, I think that would be something that is going to be really, really helpful.
That's pretty useful actually.
Yeah, that is very useful.
Yeah.
So, do you do programs at schools too, things like that in
In fact,
Singapore?
yes.
Yeah.
Like just a month ago, we did 3 sessions for reference institution.
Oh, okay.
Wow.
Yeah, and I think it's something important, right? That you
Yeah.
know, we begin from the young,
For sure.
right?
Yeah.
And equip them with this soft skills that is long lasting.
Yeah.
Prepare them for the workforce.
Yeah,
that's
super
always
important.
changing, especially
Yeah.
now with AI, you know, and
Yeah.
many things that's rapidly evolving.
Yeah. Yes.
I think
yes.
mental health is like fortitude. This is like mental fortitude, I guess.
Yeah.
It's pretty
Yes.
insane. I know Tiger Woods.
Oh,
He
yes.
used to- you know
Right.
what he did last time? His father used to do. Whenever he wants to swing, because you know golf is like a mental game, right? You gotta
Yeah.
swing, right? But whenever he wants to swing,
Gets abused or something.
No, the father would purposely drop something,
Oh, right.
and like
yes.
he's just like, yeah, then he got to do the whole thing again, and like he keeps on doing that until he just like so
Yeah, it
mentally
doesn't
strong
even-
now, and like doesn't matter. That's why he can
Yes.
play in like big like tournaments and like people like shout and things like that. He still scores, you know. So
Yeah, for sure. My father was actually a student advisor in university, and so he was also always talking about. Even with me, he recognized certain issues. Like I think throughout my career, he said, just watch your health, but also be mindful that you've never had a massive failure before. So he's actually making me aware that when it happens, you are going to feel a certain way that you've never felt before, and please don't think that the world will end, right? So and you have people to talk to, because I think also, you know, Singapore, one of the things when you are such a successful nation is that we sometimes don't stop to actually be able to learn from our failures, and we get so shamed from failure to the point that we don't want to try anything,
yeah,
right? Yeah,
right.
and so that's always also a tricky thing to do.
But you know
So-
what will buy your course? Who will buy your course? Dentists. I think dentists will buy your course a lot. There's so much burnout among
Oh yeah,
dentists.
for sure. Dentists,
Because
doctors
we
too,
talk
right?
about the commodity thing and everything.
Yeah.
So you either absorb it and take it in and you burn out over time because you just get stressed all the time. And in fact some of my friends are also burn out already, right? So and
Yeah,
they take
yeah.
a long holiday or they just change their industry. I think dentists have the highest suicide rates. I don't know whether that's true.
Yeah, apparently now it's taken over by doctors.
Really?
Yeah.
I wonder what type of
Doctors in the US, especially past COVID, because the I heard this from another podcast, but they were talking to doctors in the US, and there's such high suicide rates now because a lot of the doctors saw deaths in their patients when it could be avoided just by better medical policies.
okay.
So again, it's one of those things where they feel so helpless
Yeah.
that, you know, I came into this profession thinking that I could help people, but now the system is as such where, you know, like now with the US aid, you know, it's
Yeah,
taken
yeah.
away, the funding is drying up, and so people are literally dying. And so the doctors are very depressed, and also they're overworked, right?
Yeah.
So
So yeah, you can like launch this course for dentists and healthcare professionals.
yeah, for sure.
I think this is gonna
Sure.
it's good.
Yeah, it's very good.
I
Yeah.
think it's like having been through what I went through. Yeah, that's why I feel the passion to really support others in this, right? To kind of take care of our mental health,
Yes,
right?
yes.
Our
Yeah.
well-being, right? So that, you know, we can really live life in a way that's more fulfilling, right? That is meaningful as well. Yeah.
Yeah, wonderful. Well done.
Oh, nice. All right, with that bombshell, that sounds like Top Gear. We'd like to end our podcast today. Thank you so much for having us. Thank you, Eric, for coming over today.
Thank you
It
for
was
having
really, really, really in depth, and we really understood a lot about sleep and insomnia. A lot.
I'm gonna
Thank you
take
so
some
much.
of these
Thank you
things
for
home.
having me. Appreciate it.
Yeah.
Yeah. All right. Thank you.
Thank you.
Bye.
Bye.